right, looks like we have everyone. Good afternoon, everyone. I'm Tina Verona, Director of Media Relations for Hartford Healthcare. Thank you for joining us for this media briefing, and I'm so happy to be joined by my colleague, Dr. Ajay Kumar. He's our Chief Clinical Officer here at Hartford Healthcare. I know you all have lots of questions about the Delta variant and unvaccinated, so that's the reason we're doing this media briefing. So Ajay will do a brief introduction first, and then you can ask your questions. Ajay, take it away.
Good afternoon, everybody. Well, thank you for being here. My name is Ajay Kumar. I'm Chief Clinical Officer for Hartford Healthcare. And I was hoping to talk about a little bit about the status of COVID in general and make a plea about the vaccination to a certain extent. Let me start with the Hartford Healthcare. We have about 23 patients today admitted in our hospital systems across our system. We have about 7 patients in Hartford Hospital. We have 5 patients in Bacchus. Hospital Center, Connecticut has 5 patients, 1 patient in Wyndham, 1 patient in St. Vincent Medical Center, and 4 patients in Mid-State Medical Center. And our Charlotte Hungerford does not have any patients which is COVID positive. And the reason I want to talk about this 23 patients, although seems a lot lower than what we had back during the peak of the second surge, but it's similar to what we had in August last year exactly at this time. The state actually has about 66 patients admitted in the hospitals across the system, across the state of Connecticut, and we are seeing a slight incline at the moment on the hospitalization. Now, what's most interesting for the data to note is that about 68% plus of our community is vaccinated with at least 1 dose. 80% adults are vaccinated, and Connecticut has done a good job. But still, my plea is to the 20% people who are not vaccinated at the moment. This pandemic at this time has become a pandemic of unvaccinated. We are seeing increased number of patients who are coming to the hospital who are unvaccinated. Predominantly, all patients who gets into the ICU, pretty much all patients who gets in the ICU are unvaccinated. And as you know, when you get into the critical care setting with COVID, your mortality remains high. So this is the time for us to be proud of where we are with where Connecticut is in the vaccination side, but at the same time to be cautious, especially for those who are not vaccinated. And I ask everybody that who is unvaccinated or on the fence to engage with the healthcare providers and ask questions about the pros and cons, and hopefully make a decision which is consistent with safety of our society and safety of your family and yourself as well at this time. There is a wonderful summer we are enjoying with a bit of rain at this time, and we are blessed to have this summer because we've done a good job with vaccine, and we can feel some of the freedom at this time in getting about and we don't want to go back to the place where we have to constrain ourselves in any way. So we are so close at this time in getting our society in a place where we can be safe. And my plea to all those individuals who are listening, who are not vaccinated, to engage your providers and your healthcare personnel and discuss about pros and cons of vaccines. Vaccines are exceedingly safe at this time. And if you look into the 2.1 million people actually who have received the vaccine across the state of Connecticut, we were 854 patients with breakthrough infections, 393 patients with symptoms, 150 hospitalized, and 21 deaths. Essentially, if you're vaccinated, your mortality is 0.001%. If you're not vaccinated, your mortality is extremely high, almost 100 times higher. So I hope this is enough to worry or get people concerned and at least talk about the pros and cons of vaccination. But I encourage everybody who's listening at this time to have a conversation and consider vaccines seriously. With that, I'm going to open for any questions and comments. Well, before I get there, let me talk about Delta variant. Delta variant, as you know, is a variant which originated from India, caused havoc back in South Asian countries. We've had significant amount of mortality we've seen over there. This is a highly transmissible variant of the virus, not necessarily more lethal than what we've had before. But we are seeing this increased number. More than 50% of our positivity in the state of Connecticut is Delta variant right now. And the concern is because it's highly transmissible, the best defense we have right now is to continue to get vaccinated. So at least if you get the infection or you get colonized or you get exposed to somebody who has COVID, you're not getting as sick, requiring ICU or hospitalization or facing mortality. So Delta variant is something to be taken seriously. And where we are in the country, as you know, in some parts of the country are seeing a rising significant increase in positivity rate. We have seen a slight increase in Connecticut, a very tiny bit increase. We have about 1.47% in the last 7-day rolling average right now. And although it's in a good place right now, but this is where people like me start getting concerned about where we are heading right now. My plea to everybody, this is especially for the unvaccinated individual, please engage your healthcare provider and discuss about vaccination.
Ajay, thank you. We're going to open it up to questions. If you can write your questions in the chat, we'll be sure to get to you so that we can keep everybody in order. Our first question is from Alex Putterman at the Hartford Courant. Alex, you're up.
Thanks, Tina. Dr. Kumar, you mentioned that the vast majority of people in the hospital and in the ICU are unvaccinated. Do you have specific numbers, specific breakdown of what those?
Alex, yeah, it's difficult and sometimes misleading to talk about these numbers. Let me explain to you why. Because occasionally we have patients actually who are vaccinated and may have had COVID a little while ago, and they continue to remain persistent, but they come to the hospital for unrelated reason, unrelated to COVID. They broke their ankle or some hip surgeries and things like that. So it could be misleading right now. What I can tell you, the individuals who are getting admitted to the hospital because of COVID symptoms after getting vaccination is extremely, extremely small. I mean, I know about a couple of cases in the last 2 months or so. So it's a very small number. I hope that explains
the
answers.
Yeah, and one other question real quick. So a lot of people had said a couple months ago that we were kind of in for a pretty low COVID summer. I guess, are you surprised that we are having this uptick, and how should people process the fact that they were sort of ready to go through the summer without worrying too much about COVID, and now the Delta variant is here and we have to kind of think about it again? Yeah,
I'm not surprised actually. We may see some increase in fall as well, and especially it's going to affect those individuals who are unvaccinated. Look, we are enjoying the summer. The folks are getting out and about, which is the right thing to do. And I think there's a bit of a laxity on the mask use as well in places where it probably should be used. And recent rain and all the weather we've had, folks have gone indoors, so you get exposed and you come back, and especially the unvaccinated individuals, get infected. So we are going to see some fluctuations as we go forward. I think it's going to increase a little bit more in the fall. But that applies especially to the individual, unfortunately, those who are unvaccinated, because we are going to see that effect on the hospitalization and being sick predominantly in that population. The questions coming up quite frequently regarding about the age range. We are seeing increased number of individuals who are unvaccinated, and especially those who are unvaccinated are generally younger population. So it's predominantly in the younger population. In the hospital, we have a bit of a variation. We have a variation anywhere from 20-something plus year old to 70-something plus right now. That's what we've been seeing, but very occasionally somebody with 70 plus range. And those individuals, again, are unvaccinated at this time.
Alex, thank you for your questions. Ajay, we have our next question from Sierra Hooks from the New Britain Herald, Bristol Press. Is the Delta variant affecting young people more than others?
Well, Delta variant does not know age, honestly. It's affecting those who are unvaccinated. And it does know that, actually. And it is affecting those individuals who are obviously in a congregated setting and unvaccinated and being exposed, or folks who are traveling. But it's not necessarily age difference we've seen.
Thank you. Our next question is from Mary Ellen Godin from the Record Journal. 2 weeks ago, the CDC stated there was no need for those who received the J&J shot to receive an mRNA booster, but recent studies are saying otherwise. Has Hartford Healthcare changed its guidance?
Mary Ellen, we have not changed our guidance yet, although we're watching the development and the science and the research at this time here. And there's a fair amount of conversation happening nationally and internationally around this issue. And we're going to continue to watch. I believe our CDC is making a very logical decisions around that. I feel the FDA has actually done a good job in managing the message around that. So we will watch it carefully. And obviously, this is an evolving science. If it seems like ages, but it's only about 18 months since we've had this pandemic with us, and hopefully, we will learn more and will adjust as we find more knowledge.
Our next question is from Tracy O'Shaughnessy from the Waterbury Republican American. Could you quantify the increasing number that you mentioned? And did you say the unvaccinated have a mortality rate 100% more than the vaccinated?
About 100% more. That's right. Based on the data I just shared with you regarding the 2.1 million people who've been the breakthrough infections information we know in Connecticut, and I'm comparing to that data at this time. I do want folks to know this mortality remains significantly higher still in those individuals who are unvaccinated who require hospitalization.
Our next question is from Dave Altamari from the CT Mirror. Can you give us a breakdown of the 23 patients by age? Are patients younger than you were seeing before?
Because the number is so small, it's difficult to make a generalized comment, but we have seen, as I mentioned, the age range of 20-something to 70-something is a range right now. And predominantly, it's a younger age group at the moment. If I track back the last 3 months information, it's predominantly in our age group.
Our next question is from Susan Raff from Channel 3. Do you think the state should continue mask wearing in some cases or put some travel restrictions in place?
I don't think so. The state has done a very thoughtful decision making so far, and I suppose state's policy. I think there's a balance out there of somewhat to be able to live normally and to manage the pandemic. I think the state's message regarding the vaccination should be taken seriously. But regarding the mask and other details, what the state has been following has been very prudent so far.
Our next question comes from Brian Hellenbeck from the Day newspaper. Are there situations in which you would recommend those who are vaccinated wear a mask?
Brian, it's a very good question. If you're immunocompromised and if you have significant comorbidities and you're going to be in a setting where there is a large amount of crowd and you don't know whether the individuals are sick or are unvaccinated, if it was me, I would take a precaution and wear the mask. But my recommendation would be that people should consider seriously wearing a mask in those settings where there's a higher risk of exposing yourself and having some underlying comorbidities at the same time.
Follow-up question from Susan Raff from Channel 3. The question about masks and travel is from Susan Raff. Okay. Tracy, up next from the Waterbury Republican American. Los Angeles County implemented an indoor mask mandate even for vaccinated people. Should we do that? Is there any point where we may do that?
As I mentioned, 80% adult vaccination, 68% vaccination in general population. Connecticut is in a much better place right now. And with the prevalence where we are right now, I wouldn't want to jump into that level of mask mandate or suggestion. I think it's a careful approach by individuals who have underlying conditions or are in an unfamiliar situation in a large crowd. That's where I would say folks should consider wearing a mask. That would be my recommendation. Tracy, you're raising your hand as a follow-up.
Yes, sir. Doctor, what about the people, you cited a number of people who had breakthrough vaccinations, and we're seeing some Olympic athletes having to not withdraw from the Olympics, despite their having been fully vaccinated. I wonder if this calls into question for the unvaccinated, the real efficacy of the vaccine. If such kind of dire consequences come to some very high profile figures who felt like they did the right thing and nevertheless got COVID, sir.
Tracy, it's a good question. If I understand your question accurately, and I'll try to answer that. If I'm vaccinated, if a high profile individual is vaccinated and still get COVID infection, does it call into questions about the vaccination? I think that's what you're trying to get at.
Yes, sir.
Yeah, So I think we all need to know some of the basic information about that 95% efficacy of mRNA vaccine. That means 5% still will get infected and will be sicker, or at least get sick. The interesting thing to know, the likelihood of them dying or death is very, very small. And that is the important thing for us to know. The second thing is a vaccine does not prevent virus to getting inside our nasal cavity or in the body. There's no barrier the virus creates. What virus creates is our ability to be able to fight it and not get sick with that. So interesting thing which is happening, especially in the Olympic athlete, is that they may not be sick, but they may have had this virus in the nasal cavity and carrier, and they've been flagged as obviously as positive, which is the right thing to do, because for the same reason, they're preventing and protecting other individuals who are unvaccinated in that time here from getting the infection, who, if they get the vaccine, have higher likelihood of mortality and death. So I think this is something we have to continue to educate everybody that vaccines will reduce your likelihood of dying, will reduce significantly your likelihood of getting to the hospital. But there is 5% of the individuals will get sicker. And the very, very small fraction of percentage, as I talked about, 0.001% out of 2.1 million may actually unfortunately die. And generally those individuals have multiple comorbidities.
Sir, just one more. Do we know, you talked about carrying the Delta variant or carrying the virus in your nasal cavity. Do we yet know whether such people may not, I'm talking about vaccinated people who are carrying the virus in their nasal cavity, they may not get sick. They may not even know that they're sick. Do we know what the possibility of their transmitting that virus to another unvaccinated person through that nasal cavity is?
This is a great question, and I don't know the answer on that. Although I can say it's low, but I don't know how low it is.
Actually, we have a follow-up question from Alex Potterman, and it's actually a personal question to you. Has the Delta variant changed your behavior in any way? Have you begun taking more precautions since the numbers started to increase?
Alex, personally, I do wear a mask when I'm in setting outside unfamiliar to me. I do actually continue to take precautions with social distancing and hand washing and all those things. And I have not gotten relaxed on that part here. And the reason is one, I do worry about even me getting exposed, being in healthcare setting, from those individuals who are maybe unvaccinated or maybe sicker, and I could be in a surrounding where I could carry that virus back to the workplace or other areas as well. So it hasn't really made me more relaxed about that, at least given the vaccination side. But at the same time, it strengthened my belief in vaccine, only because I've seen the mortality is significantly lower and the hospitalization is significantly lower.
We have a question from Dave Altamari from the CT Mirror. Do you anticipate a third wave in the fall when schools reopen? And if so, what would that look like?
Yeah, it's a great question. I hope we don't have a third wave in Connecticut. I think we will see some uptick at some point, given the unvaccinated individual. But I still live on the side of the optimism that the large majority of Connecticut residents will get vaccinated. When the vaccine's available for less than 12-year-old, there would be predominant individuals will get vaccinated. Our schools are doing a great job with mask and social distancing and all the screening and other things as well. So if we continue to remain disciplined, I think we will avoid the third wave of significant consequence. But time will tell.
Follow-up question from Tracy at the Waterbury Republican American. Could you please restate the number of COVID positive patients that Hartford Healthcare is treating now? Thanks.
Tracy, of course, 23 patients today in our hospital system. And out of them, 5 are in ICU and everybody else is in the floor setting. Tracy, you're on mute.
Mute. Okay, sir, what were those numbers say 2 weeks ago?
2 weeks ago, on 26th, if you give me 1 minute, I will look into that. I'll come back to you, Tracy, in a moment. I just have to look at the numbers accurately. the meantime, is there any other questions? while Mike comes
Yeah,
in?
any other questions? I don't see anything in the chat. We have a few minutes left with Dr. Kumar, so I would take advantage of that. If you have your questions, ask now.
Tracy, I will have number sent to you via Tina if that's okay with you. I believe it was like 8 or 9, so it's more than doubled, but I'll confirm it. Somehow it's taking a little while for me to get the numbers right.
Thank you, sir.
Any other
Very good.
questions?
Well, if there's no other question, I can just make a few comments. As I've said that before, the media plays a really important part in passing the message and appropriately messaging the team. And I do want you to highlight this is becoming a pandemic of unvaccinated right now. Our hospital systems are concerned about unvaccinated individuals facing a higher hospitalization or mortality at this time. And we need to continue to pass the message, the importance of vaccination at this time. We've done a good job in Connecticut, but we can do much better job than where we are right now. And your assistance and your messaging would be tremendously helpful in getting to that phase. Tracy, I got the number on July 16th, we had 15 patients. And July 11th, we had 12 patients.
So July, okay, so July 15th, July 12th, you had 15 patients, and July 11th, you had 12. Is that correct, sir?
That's right.
Okay. Thank you, sir.
Great. All right,
Very
if
good.
there are no other questions, thank you, Dr. Kumar, and thank you for all the media for participating. We appreciate it. Have a great day.
Thank you.
Thanks, Dr. Kumar.
Thank you,
Thanks,
Alex.
Kumar.
Thank you. Bye.